Welcome to The Intentional Clinician. I'm your host, Paul Krauss, licensed professional counselor. In today's episode, I will be talking with Dr. Noe Vargas. Dr. Noe Vargas has a doctorate degree in behavioral health from Arizona State University and is the assistant dean for the College of Humanities and Social Sciences at Grand Canyon University. Dr. Vargas holds an independent Arizona license as a professional counselor. He has been certified by the Green Cross as a field traumatologist, I can't talk, is a national certified counselor, holds the Master of Addiction Counselor certification, and has met the Arizona Board educational requirements to be a clinical supervisor. Dr. Vargas specializes in areas of psychological trauma and substance abuse, and he has been trained to work side by side with medical doctors, integrating behavioral health and medical care. Dr. Vargas has taught undergraduate and graduate level courses at different universities and community colleges, and routinely makes professional presentations on topics such as understanding childhood trauma, cultural diversity, effective parenting communication, integrated health, and other behavioral related topics in different settings. So, Dr. Vargas and I are going to talk about a range of topics, including trauma and some of its effects on refugees and immigrants, and also how to help them in counseling setting. So, Dr. Vargas, welcome.
Thank you for having me today. Appreciate it.
Absolutely. So, I appreciate you giving me your time today, and I guess a little bit, just to start off and break the ice, how do we know each other?
We know each other because you were teaching at Grand Canyon University. I don't remember the timeline, but you were teaching for us for some courses in a master's program for counselors.
That's right. I do remember that, and then we met, and you were the basically program chair, or what do you call it, director?
I was a director at that time, and then I got promoted to be an assistant dean now.
Oh, okay.
Yeah.
Congratulations.
Thank you.
And so we had some fun times there. And so kind of, to start things out in the interview, usually I ask people kind of to tell me a little bit about their story, any part that you want to talk about, your personal story and how that led you to here.
Well, I do want to say, I'm from Mexico originally. Just get you the understanding. I'm an immigrant in the United States. I came to the U.S. in 1989.
Right.
I was not born in. I was not alive in the 1800s. 1989, and so I basically came to the U.S. Went to school, went to high school, and then went to community college, trying to find out, what is it that I want to do in life? Who am I? Those questions that we ask ourselves. And I was actually in accounting, in the accounting field. I went to accounting, and then I didn't get along with numbers so well. And so I then said, maybe I want to work with humans. And I switched to psychology. And, that led me to went to ASU and got an undergrad degree in psychology. And then went to another university to get my master's in counseling, because psychology is great, but what I saw at the university was very general theories, didn't really see any application. So then I went to the master's program into counseling because I really wanted to do counseling, and then decided to go for my doctorate. And at that time I didn't want to go back to do psychology for 7 years. So I found a degree that was shorter and still helped me be in the clinical setting, working with the medical doctors, kind of working the integration between behavioral health and medical health, and then graduated, and here I am, I guess. I mean, that was a short kind of...
That's excellent. I have a few questions about kind of your earlier life. How old were you when you came to the United States?
I was 16.
Oh, okay.
Yeah, I was 16. There, my accent, I couldn't get rid of my accent, and research shows that apparently, after 14 years of age, if you learn a second language, you can get rid of the accent. That's what the research says, and I'm not sure. I guess it's true in my case.
Yeah, I like your accent, so
thank you.
That's good. I was just curious, what do you think? I mean, you said you wanted to work with people and not numbers. Is there anything in your life or something you were thinking about or going through at the time that led you to psychology in particular?
I have never actually said this to anyone, so I'm going to do it to you, but it's very interesting. I do believe I was called to be a therapist. I woke up one day, I had never ever taken a psychology course, readiness in psychology, and I said I'm going to be a psychologist at that time. I woke up and I said that, and I went and switched my career. Had never taken a psychology course. but knew that it was working with people, and that's how I decided to be a psychologist. Well, I'm not a psychologist, but at that time I wanted to be a psychologist. That's how I went into the field. I know maybe there's no substance to people, but I once I started then working into the trauma field, I felt like I was supposed to be there, and so I feel that this is what I'm supposed to be doing in life.
That's awesome. Yeah, that's excellent. So you almost had this like kind of physical and mental calling. You just woke up one day and you went and changed your major.
And I think it was more of spiritual kind of, and that's why I really don't talk to people about this, because some people might not necessarily understand, and since it's my story, I kind of want to keep it for myself, and since I understand it, that's to me that's all that matters. But
yes.
But it's more of a spiritual thing that happened in my understanding, because when I started working with trauma victims, and then started working with complex trauma victims, I felt like, this is what I'm supposed to be doing. And so, I don't know. It was just magical to me.
Well, there's no topic off limits here, so I can see that. So there was a spiritual, almost like you felt when you were working with these victims of complex trauma through your job, that opened you up to something bigger.
Yeah.
And what was that?
When I started working with children, actually, then I was already a therapist at that time. Now we're fast forwarding some years. I was working with children that were unaccompanied minors. They were crossing the border on their own and being trafficked, some of them, sexually. And they were captured by ICE and then put in different programs. And I was working in a program. And I started working with these kids, and I realized I did not know how to treat their symptoms. They were having symptoms that I did not necessarily see in kids. They were telling me stories that I was really not prepared to hear. So at that time, I went back to school and got a certificate in trauma, because I felt like I needed to be prepared. Kind of saying, I need more tools, even though I don't like the word tools, but just finding, I need to know more as to how to help these kids who are being trafficked, who have horrific stories, really sad, and like I said, we had refugee girls being trafficked in Texas. They were being rescued by the FBI. We actually had some of those. So we had all these kids, and so I said, I need to go back to school, and went back and got a certificate in trauma, and then become certified by the Green Krauss Academy of Traumatology as a field traumatologist. And then I went on, and my concentration was trauma.
So it sounds like, when you were at that time, when you had first become a therapist, you hadn't really dealt with too much trauma until you started working with these kids. Is that what I'm hearing?
Yeah. I had no understanding really about trauma or even disorders or anything like that when I decided to be a therapist.
And so, just to kind of draw a little bit into the story, because I think this is a very important part of the story, it's kind of like that. Sometimes when we're in our culture, we get a degree to do something, and we kind of follow the rules and go to the courses, and we know the techniques and the tools, and then we get thrown into a situation where you're working with the most vulnerable people possible. These are kids without even parents.
Yeah, I actually worked with, I have a few cases in which they did not know the father or the mother who had brought them to the U.S. They were like 12, 13. They had never met their parents because their parents left them when they were kids with their grandparents or uncles and aunts in, whatever country that would be. And so they were coming to meet them in person. Yeah, and those were very heavy cases, because the kids would decompensate once they would meet the parents. Instead of being happy, they would just all this, hyperventilation. They would just get into this panic mode, because they were now have met the person that brought them to the world, but they never met them. And all of this time, sometimes they were taking care of their younger brother or younger sister, and now you have this person that you never met that you're going to go and live with. And
they were kind of trying to get to meet their actual biological parents?
Yeah.
Is that what you're saying? Yeah,
so the biological parent was the one paying for basically the trip to the U.S., and they would pay for the coyote to cross them through the border and all of that.
And they were doing that without the proper paperwork and all that?
They didn't have any legal paperwork. The parents sometimes don't have any legal status in the U.S., so there's no way they can do that. So they had to do it that way. But then the kids were detained and
they were
by
caught.
ICE, exactly.
Right. And so
they were released to them, but then they had to continue the immigration process after that.
I see.
And the refugees are different because the unaccompanied minors are called immigrants.
Right.
The refugees are different because they already come with documentation. They come with immigration papers, but they're still separated. They will bring the children first, and they will keep the children for 4 or 6 years here until the parents can come to the U.S. because there were different refugees, the minor refugees and the adult refugees.
Oh my goodness, and they'd separate them?
They separate them, yeah. They don't come as a family.
Wow. Okay, there's so many topics to delve in here because
sometimes,
I've studied a lot of these things, and I actually have worked with both refugees and immigrants. In one of my jobs in Phoenix, I worked with refugees coming from war-torn areas in Africa, and then also immigrants from Mexico and other countries as well, I believe, some Eastern European countries. And everyone's got a bit of a different story because, and the refugees normally, I mean, you're a bit more of an expert about this, but the refugees usually the United States has decided to take a certain number of people in that are from an afflicted, persecuted, possibly population. Am I on the right?
Correct, you're correct.
And so maybe from a war, or somebody's coming after their sect of people, their tribe, so to speak, or their religion. And then we've decided, okay, they're going to be basically die if we don't bring them in, or something really bad is going to happen. They're going to become put into sex trafficking or become child soldiers or something. So we take them back into the U.S. and say we want them to be part of our country, and we take a certain number of the refugees in. We do all the paperwork for them, or maybe the Red Cross or somebody.
Actually, you're right. It's just the thing that we need to think about is the timeline here.
Right.
Because they, let's say, flee their country of origin. So let's say they come from. We used to work with a lot of people from Nepal. Although they would have a refugee camp in Nepal. They were Burmese. The Burmese.
Okay.
I worked with a lot of them actually as part of my caseload at that time. So they were going to a refugee camp first. That's the first step. Because they had to be certified by the UN.
Oh, by the UN.
Yeah, the United Nations, right? So they go in there. So then the United Nations goes in and kind of puts them in this list, whatever the country is going to take them, right? But for that, it can take years.
Yes.
So they have all this second life, per se, before coming to the U.S. or to any other country in the world, that they're living in this concentration camps. A lot of things happen there. A lot of things can happen there, right? And so sometimes then they'll say, okay, we have space for the children, so they bring the children first and leave the parents there. And they put them in foster homes here, and that's the ones I used to work with. Their children.
And they're waiting for their parents to get clearance from the refugee camp.
Yeah, because there's only a number, like you said, there's only a certain number of people they can bring every year, the U.S. or any other country.
Right.
Okay. Now, the U.S. Historically has taken more than any other country in the world.
Right.
Yeah. And so I remember I worked with this particular boy from Somalia who became an adult before he even saw his parents again.
Oh, my goodness.
Yeah, he was in the foster parent system here. And, okay, it's sponsored by the federal government.
Right.
And so that happens. Sometimes they come separately, and they come already with their papers. However, the adults have to pay for their plane ticket after they've been in the U.S. They have about 6 months to pay the plane ticket back to the government. And if they don't, then they put them in collections and all of that. They give them the American, they teach them the American way.
The welcome, right?
Yeah, the welcome. But they come already with papers, and there's organizations here. They help them. It's called resettlement.
Okay, yeah.
They help them through the process. They go through this program, and when they get here, they give them an apartment. They give him some social services, and it's been a while since I actually worked with the actual structure program. Now I kind of work on my own with more immigrants now than the refugees, but in private practice. But when I actually was in the program, it's very structured as to the timelines too.
Right.
Yeah, but the concentration camp period is the
Or is
critical.
it actually called a concentration camp or a refugee camp?
I'm sorry, did I say concentration camp?
Yeah.
I'm sorry, it's a refugee camp. Thank you so much.
Right.
I've been saying that all this time.
It's okay.
I don't
I'm sure our listeners
I
understand.
didn't. Yeah, I didn't mean that.
That's okay. So, I want to make also talk about the post-traumatic stress disorder and different depression and anxiety that these both adults and children go through. But I was just reading the other day. This is an article on the U.S. Department of Veterans Affairs website and the National Center for Post-Traumatic Stress Disorder, and they were talking about refugees. And this is years ago, but in 2002, the U.S. Committee for Refugees estimated there was 14.9 million refugees and 22 million internationally displaced persons in the world. And basically, this escalating international crisis has developed over the past 60 years as organized political violence has increasingly targeted civilian populations. Refugees are men, women, and children from virtually every income level and living arrangement. As refugees, they have left behind their livelihood, their communities, and most of all of their possessions. Although a large number of the individuals do adjust well, many suffer psychological distress as a result of their exposure to traumatic events and the hardships associated with life as a refugee. And it was talking about some of the, even before they flee to the refugee camp and maybe get, some help by the UN or another organization, they may be witnessing fighting, destruction, observe violent acts perpetrated against loved ones, be subjected or witness sexual violence. Some of the studies shown that a lot of them had witnessed torture or been tortured or been isolated or seen a family member get killed or a family member just disappear. A lot of them had been, I'm not reading all the percentages and statistics, but like it said, 67% had been deprived of food and water. 60-something% had been near a combat situation. 62% reported being close to death, which in the clinical diagnosis of post-traumatic stress disorder, I mean, I'm just hearing a lot of the triggers that could have caused someone to have it. And then post-flight, they're in these camps for a long time, these refugee camps, and then before they get resettled, or if they get resettled, having left their homes, refugees are often forced to confront isolation, hostility, violence, and racism in their new locations. Individuals who are resettled in refugee camps often face living situations that are at times overcrowded, rife with the threat of infectious disease, and primitive in design. Additional chronic stressors that refugees must deal with include socioeconomic disadvantages, poor physical health, and the collapse of social support. So, and then it talked about the prevalence of PTSD, and it just varies on where they were coming from and what happened in their story, because it was saying the sample showed prevalence rates from anywhere from 4 to 86% for PTSD and 5 to 31% for depression. And of course, we know culturally sometimes people don't identify depression. In different cultures, it might not be culturally okay to do that.
All right.
Anyway, this is a long story, so I will post that in the show notes, or a long article. But that was just the refugees, and I wanted to talk a little bit about the trauma there, and then talk a little bit more about your experience with the immigrant children that brought you to this field. So,
yeah, you really read so many components or environmental issues that can cause trauma for someone. And yeah, they're talking about PTSD, but we look at childhood trauma, which now we have a PTSD diagnosis for children, the DSM-5. However, you think about a mother who may get pregnant in the refugee camp, who had experienced trauma prior to being pregnant or throughout her life, and you think about the trauma that is going to be passed on to the child too, right? So the child now is born in this refugee camp, and then now they have to flee to another country where now the mother has all this trauma that has been dealing with for a while, and now it comes to the U.S. or to any other country in the world, but the trauma that the mother's carrying, now can be passed on to the child because the mother is not being regulated. She's experiencing all this trauma. So that's one trauma that we don't talk about much, because I know that when we talk about trauma, we always go to PTSD,
right?
Because that's what's been studied a lot, especially from the Veterans Affairs. They're going to study that a lot, right? And yeah, I do believe in PTSD. Of course, I think there's a lot of people that have PTSD, but I want to mention that there's other traumas out there that sometimes we don't necessarily pay attention because they're not in the DSM-5 and we don't study them, you know. There's the developmental trauma. So for me, the way I define trauma, so let me give you my definition first so maybe you can understand where I'm coming from. To me, trauma is anything that disrupts the normal development of any human being, okay? And disruption can be emotional, psychological, physical. And of course, it has to have some type of hardship at those levels, you know,
Right.
Because there's different disruptions. And I know we don't like to use the word normal in
Sure.
psychology for
Sure.
those people who hate that word. I do believe that there's a place in the field because we do have abnormal. So how can we have abnormal when we have normal? You know, we have
Right.
to have both.
We have abnormal
Exactly.
psychology courses. Right?
Exactly. So how do we have then? What is abnormal? What are we being abnormal for from the baseline, from the mainstream? So that's called normality. Even though and I know as a diverse person that we can go into what's normal for you is not normal for me, but there's certain normality in development.
So we're talking about real quick. Just I'm going to throw in something possibly just kind of human needs that are global, such as Maslow's hierarchy. You know, food, shelter, water. Safety and some stability. I mean, we're humans. There's not going to be always stability. That's sort of a myth. But having a little bit of a safe place to go, and then we could go higher and higher and higher. And of course, when we were talking about what's normal for me is not normal for you. I mean, we're talking about cultural and higher level and you know, social things. But on the base level, a lot of people that are not having normal development are. What we mean is that they don't have access to basic human needs being met.
Like safety,
right?
You know, reassurance, nurture. You know, the nurture versus nature. There shouldn't be a versus. They should be both. Both go together. Nurture and nature go together.
Right.
Not versus. You know.
Right.
In my opinion, because you need the nurturing, you need the love, you need the caring as a child. You know, your brain is developing, you're developing neural pathways. You want to develop those neural pathways. So when we talk about, go back to the trauma issue, we think about displacement as a traumatic event. And that's actually being captured now in literature, where they see displacement as a traumatic event. Okay? So children and adults go through this process, but remember, who's supposed to be regulating and giving safety to the child? Is the adult, is the parent. But how can a parent do that when they are having all these traumatic events happening to them and they're reacting to them?
And so let's talk a little bit about their reaction. You said that the mother needs to be regulated. We're talking about emotional regulation, and we're talking about physical, and we're talking about the fight, flight, freeze response, and hypervigilance, and a lot of things that maybe they don't have, quote, full PTSD according to the Diagnostic and Statistical Manual of Psychiatric Disorders. But what we're talking about is a spectrum of trauma. We're talking about these things happen, and everyone's a little bit unique, but if they're you know, a child's developing the neural pathways, but the mother or the father or whoever may be completely distressed and behaving in ways that are erratic, maybe mood swings,
and or different type of you know, where the brain has now become so hyper vigilant because I'm having now this event has triggered my brain or has shifted my brain. Where now I'm looking at the safety. You know, am I safe? Am I not safe? You know, when am I supposed to be looking for another event?
So they're almost looking for signs of, am I going to be hurt? And this is an easy example just for our listeners would be kind of an American soldier that comes back from a war and who's been in a combat zone. If you know anybody, oftentimes, you know, ask them where they want to sit in a room. They're going to sit facing the door, and they're gonna, or in the restaurant, they're going to sit in the back of the corner so they can observe the place for threats.
Exactly, they're hyper vigilant. They're always looking for that. So we're looking at here what we call the acute trauma type 1 trauma. You know, like very one event.
Right.
You know, this mother, for instance, I'm using a mother as an example in the displacement process in the refugee camp. You know, the experiences they may have, and now they have more trauma coming out in their lives, and now we have moved from acute to chronic. You know.
Right.
And that's where we're gonna see more of the symptoms for PTSD, in the more of the traumatic and the chronic
So they've had multiple traumas and not time to recover or treatment or any help. And so then they're supposed to be helping the children, and the children are, you know, wanting their mother to be there, and then their mother is unpredictable. So what I'm hearing is, this goes into attachment theory, which we don't have time for, that's a whole other episode, but we're hearing, you know, the child comes to the mom, and they're crying, and a lot of the times, if the child is sincerely crying, a mother will comfort the child, versus a child who's, you know, acting out, manipulating the mom for some sort of treat. That's different. But if the child is coming genuinely upset and scared for safety, or something happened, the mother will comfort. But if the mother has had trauma, they may react randomly, or ignore it, or cold, or confused, or angry, because they are being they are not able to regulate their emotions. And so then this is passed on to the children, and this puts them, if we've, of course, the ACEs study, the Adverse Child Experiences study, for our listeners, if you want to look that up, shows that well, they did a study for years, but if you've had big T trauma or multiple traumas, you're
more likely to have, you know,
some
type of
you're more likely to be prone to addiction, early pregnancy, depression, anxiety, suicide, using drugs and alcohol, abusing them, and these sort of things based on that. So we're now having all these children who are the second generation of refugees who are having difficulties just being a person.
Yeah, if you think about it, you know, when we think about displacement, I gotta go back to that because this is big in this community.
Right.
You think about displacement. You move from displacement. See, you were displaced. You were torn apart. You were pushed out.
It wasn't your choice to move.
It wasn't necessarily your choice. You know, it was a forced choice, if you want to put it that way.
Right.
You were forced to choose that. You know.
Right.
And so it's either die or, well, I don't want to go more into that detail, but basically, then you go into this refugee camp, you're trying to adapt to that environment, which, like I said, if you study the area, you see that a lot of people spend years in there.
Right.
You know, there's children that are born there. Life continues on in the refugee camp, okay? And then you are moved to a different country, and they try to do the best they can. They try to put you in a country, or at least in a state in which the weather is similar to where you come from.
Okay.
Because, they try to do some of that stuff, but still it's not the same. You're in a different country where the culture is so different. So now you have to adapt to a different culture. Because you had to come here and you cannot live the life that you were living. You had to get to work. You know,
sure.
If you come to the US, everybody has to work.
Right.
You know, you had to learn a new language. You had to just adapt to this culture. So you have so many processes that are happening that emotionally are really affecting you, right? Because there's frustration, there's anger, there's depression. Depression is big in the area, of course. And of course, there's the traumatic symptoms that need to be addressed.
Yes, and so I can even see this. I want to contrast this. I want to talk about your work and maybe how to help refugees and immigrants. But it just popped into my brain. A good example of this is, so you emigrated, and we can talk about that at some point. But I realized, you know, I'm the grandson of an immigrant. My grandfather came over from Germany when he was 5. Okay. And between World War I and World War II, because his parents saw the rise of Hitler, got scared, came over, and got a coal mining job outside of Chicago. And even them, who were welcomed, they were welcomed. I mean, there's a plaque, they have their name on Ellis Island. My great-grandfather's name is on that monument. Oh, wow. That his family came over through Ellis Island, and they were welcomed with open arms, like, oh, good, we can get, you know, more people to help us in the coal mines and whatever, you know. And, you know, that family, even with all of that welcoming, went through tremendous strife. Should we go back to Germany? Oh, no, wait, now Hitler's ruining the place. We can't go back. What about all our relatives? We'll never see them again. You know, now my grandfather got made fun of for not knowing English when he went to kindergarten, so he had to learn English on his recess. He had to stay in the class and learn English. And of course, with him, he adjusted well because he was young and resilient. And since his family was poor, he had to go learn piano to earn money playing piano at the church. And he had to learn all these skills with his brother to make extra money working in a factory when he was young. And go learn how to catch fish and, you know, go hunting to get food for the family. and so they ended up getting a lot of skills that helped them in later life become successful in the United States in our, well, quote unquote successful in the United States with business and all of that. But even that situation, which was a definite choice, they were pretty much welcome to the community. They didn't have the greatest jobs, but even in that, there was psychological trauma. So that was a good situation. So let's go to somebody who's displaced, disrupted. You've lost your sense of home. You've lost your sense of safety, the predictability of the world. It's hard to function as a person when you don't even, you're out of your chosen place to live and your culture, and then you're trying to adjust in a new culture. Plus, you probably have now acquired significant psychological distress, which, depending on the situation, some people adjust well and are able to adapt well, and some people are severely crippled by all sorts of psychological and physical traumas, which is where I guess the work comes in to help these people on every level, not just with counseling and psychology, which was what we do, but you know, what can, if you live in a community with refugees, how can you welcome them to your community? That's therapeutic. Welcoming them into the places that you go shop, or the places that you go recreate, or you have spiritual connections.
Well, there's wow, you touched so many topics. You touched the topic of historical trauma, which is another trauma that we don't necessarily pay attention to. And I'm just going to talk a little bit about that, and then I go to your question, because the historical trauma is really the trauma that has happened, that is historical. So, for instance, in your case, you said that mostly they adapted okay. They had some issues, but mostly they were able to adapt, and they were resilient because they were really young, you said. And, but
I mean, his parents didn't. They never learned. Their English was poor, and they remained poor because of that. Yeah. But anyway.
But, you have, let's say, Native Americans. I actually did a presentation at one of the Native Americans reservations, and I was talking about historical trauma, and for them, displacement within their culture was still big, because the historical trauma is really that trauma that you experience as a child or as a grandchild of your grandparents' trauma. For instance, some in the Jewish community, there's a lot of research shows that children and grandchildren of someone who suffered or who has, close nets with what happened in, when they were mistreated, they actually pass on to the next generation, second, third generation. Why? Because it's a historical trauma. It's, you learn by hearing your parents talking about all of this horrible experiences that they had experienced, or their uncles, somebody. So you actually experience the same trauma or the same symptoms that they did, where you had never ever been in that situation.
Well, it's almost like vicarious trauma, because it's being taught. It's part of your environment, and safety is not part of your environment, and danger is.
Exactly. Yeah. So it's called historical because it's history for other people, but you experience it, right? It's not the same as traumagenic families. That's different, okay? The traumagenic families is different than historical trauma, but historical trauma is another area in which there's a lot of research happening, because how can you, as a grandchild, experience what your grandparents experienced, when you're over here third generation, first, second generation after them.
Yeah, my dad's first, I'm second.
Yeah, exactly, right? So that's just one aspect that I want to mention. That's why we talk about PTSD, and we haven't really talked about it much, but I just want to bring to everyone's awareness that for trauma, there's more than PTSD. There's just so much out there. And so let's go to your question about helping the
refugees, and how do we help them?
Well, part of what we need to understand is that when they're here, and they try to get together in their own communities. Why? Because they want to experience their own culture. They want to practice their own customs, right? And so that's important to them, because it gives them some of the safety and security within their community, which they might not experience once they're outside the community. So what you can do is, one of the things is learn more about them, right? Learn more about their religion, learn more about their culture, their customs, and be welcoming in your offices. Like, for instance, be neutral in your office. Don't have any signs of really any type of religion, regardless of your religion.
Right.
That way, when you, especially if you're working with this population, especially,
Yes.
Because you have people who are Muslims, you have people who are Christians, you have some people who are very Orthodox Catholics. So you have different people that you're working with, and within a country, they're supposed to be more Muslims, but there might be some Catholics or Christians within them, or some Buddhists.
Sure, and there's different divisions of each of those, different sects.
So you walk, your office needs to be welcoming. Learn about, like I said, their country, their culture, their religion, the type of food they eat, what they don't eat, what is it that they respect, what they value, Why? Because you have awareness, not because you're going to become an expert, you're going to start dressing like they do or anything like that, but because you have awareness, right, of who they are. And if you go into their homes, if you do a home visit, knowing at the meal times, what do they, do they have worship time, and don't disrupt those moments for them, because you are an outsider. Even though you are working with them and you're learning, you're still an outsider from their culture, and so you want to know more about them, and understand what are some of the symptoms that they may experience through their displacement. How did they get to the U.S.? Were they refugees? Were they immigrants? What happened in the journey? I worked with this kid who was a Muslim kid who witnessed his father's being killed by a bomb. So he witnessed that, and so know how to deal with that situation, and he was placed with a family. They were a very loving family, but he just couldn't adapt. He just couldn't adjust. He was in pain. And of course, as a guy, he was a teenager, he didn't show emotion, So I tried to use his faith to help him go through that, I tried to use that to guide him. So I did have to read a little bit about his faith at that time. I remember in particular when I had to do research, and I tried to engage him into something that he valued was his faith. But he had questions about his faith too.
Right.
Right? So I said, well, do you have someone in your community that is like a leader in your religion that you can talk to about those issues, and try to help him through that process. It was really challenging, but because I didn't want to get, even though I read about his religion, I was not an expert on that. That was not my area, so I connected him to someone that he could talk to about that, and I kept doing the psychological aspect. But you want to be careful when crossing boundaries into your roles. You don't want to become a case manager,
right?
Or go above your scope of practice.
Yeah, I was about to say, it sounded like you had connected him with a mentor, because if he has a mentor within his culture, he can take his pain of his father being killed by a bomb, and there's not, total choice, but there is some direction there. Does he want to take that narrative and become make us the story that is positive and makes sense within his religion and his culture and his narrative, or could he take that pain and turn it against himself or against others?
Exactly.
Because that's why we all need help. I mean, everyone needs some mentorship and some guidance in their life, but especially someone who's been vulnerable and witnessed that type of trauma. So then you helped him get connected with a mentor that could take a positive story and within the religion and within the culture, while you did work on probably trauma and other things like that.
Yeah, and the other thing you want to be careful, let me just talk a little bit about the therapists. You want to be careful with opening the can of worms if you don't know how to close it.
Right.
I want to say trauma is a specialty, and I cannot emphasize that enough. Trauma is not just like treating anxiety. I wish anxiety can be a specialty too.
Sure,
but
right.
Trauma. I have seen what trauma has done to people, and that reason why I went back to school, because I recognized that even though I had a master's degree and at that time I had my doctorate, I was independently licensed. I realized that I needed more training to understand exactly what happens. Because we see more and more of the neurological aspects of trauma. We know that this is a brain issue. You know, there's change, chemistry change that happens in the brain. There's, you know, as you know, the limbic system that gets really connected with trauma symptoms. So we really want to be careful with opening them up. You know, someone who does not understand safety, and the safety is the hardest part of the work besides the processing, and it could be the longest part of your work, is establishing safety. You know, instead of you helping them, if you don't know what to do, you're going to re-traumatize them, and it's going to really go in the negative for them and for you.
So basically, yeah, so we went into a little bit of clinical talk there.
Mm-hmm.
So, because counselors will be listening to the show too. So with counselors, you really need to have major training in trauma before working with refugees and immigrants, probably because they have the most trauma. But even if you're working with anybody with trauma, go back and get that training, because I have heard of a counselor who just has their master's degree, and they're just excited to help people with depression and anxiety, and they know some basic skills, but they don't know what's going on neurobiologically.
Exactly.
And I think that's very important, because when somebody's experienced trauma, whether we call it PTSD or just trauma or whatever, you know more than me, and I've studied a lot of this and gone to advanced trauma trainings myself and read books about this, but I know you've actually got certifications, and I have the EMDR certification, but you have like full traumatologist certification. But the brain has changed, and they are not going to react to normal treatment, our normal tools. They're not going to work to, they're not going to always respond to client-centered or cognitive behavioral therapy or motivational interviewing. They're not going to respond to that. Their brain has changed. How do we help them establish safety and get their limbic system to calm down and the fight, flight, freeze to be able to cope with that? And then the processing, which is a process for the listeners who aren't counselors, of, this is one way I describe it, then I'll let you describe it, which is taking the traumatic memory and the triggers and all the points connected to it, processing it in a safe way so that it moves from being what I call out of time, meaning that it's always still happening now. What happened in 1992 is happening in 2017, and moving it to the past. So taking it out of our primitive part of our brain, down by the brainstem and also the limbic system, the fight, flight, freeze, and moving it to where we can actually process it in our frontal lobe, where we have logic and reason, and we're able to decide how to think about the memory, versus the memory overwhelming us to the point where, for instance, the easy example, a person who's been to war hears a door slam, they still think they're at war, they dive under a table. For the refugee, it could be anything. It could be a smell. It could be someone, you know, who looks like a threat. It could be anything. So that was how I described processing, and then the processing helps a person be able to start normalizing and regulating their emotions and have a more functional life. Go ahead.
No, I think that was perfectly, and I think for those who are not therapists, you really think about, let me give you an example that you can identify with, and you don't have to be traumatized, but think about an event or something that where you feel that you don't know how to handle, that you feel like emotionally, or this is too much for me to handle. You know, that's when we call that the window of tolerance, you know, so meaning that you probably don't have the skills to handle that anymore. So then that's when you're going to seek help. You know, that's for anybody, regardless of we're traumatized or not. We all have a window of tolerance in which we can handle situations, you know, or circumstances. But when it goes above that, you know, then you feel, oh, I need help. I need to call somebody. I need to talk to someone, or I need someone to help me, you know?
Yes.
So what you were talking about is really what I call the, like the flight, I call it the airplane mode, in which you go to the past to tap the memories, you know, and to bring it to the present, to be able to function that. But when we talk about safety, we talk about we're going to help the client create a window of tolerance to bring the memory in, and within the window of tolerance, process it, right? That's what therapists do. They contain the environment to sort of work to processing to happen. And so when we don't train the client, or we don't teach them the coping mechanisms to for that window of tolerance, then we traumatize them, because we have been the creators of that as a therapist. That's why I feel it's so important for us to be trained and understand the safety, establishing safety is going to be key in treatment for trauma.
Right, because by what you mean by re-traumatizing, from what I'm getting, is without establishing the safety and knowing the neurobiology and understanding where you are in the process, you could just have them tell their story and try to process something that they're not ready for.
Yeah,
to bring up the bad trauma.
And you bring the emotions with that too, by the way.
Right.
And so then you left them on their own.
It's almost like a flashback.
Exactly.
It's almost like they're re-experiencing their father's death or something.
Yeah, but you as a therapist caused that, and then you just left them on their own.
Which is not good.
Which is really unethical too.
Right.
And now that the window of tolerance is gone because you didn't create one for them, you didn't help them create one, and now they have those symptoms that can re-traumatize the brain.
Yes, so this is exactly one of those things. As a counselor, we never want to stop learning. We always want to keep learning. And so if you ever come across someone where you don't know what to do and you start getting frustrated, that's not your client's fault. That's your issue. So go seek consultation, seek supervision, and get advanced trauma trainings. I'm so excited all the things we're learning with science now that are actually backing up everything we're knowing. Most of what we're knowing have been known for years in the counseling field, and now even more the neurobiology of trauma and learning about the brain. But then how we connect that to the human experience, because we went into a little bit of a science thing here for a moment, but what we're really talking about, and for your average person, you said, let's get to know these people, welcome them, just be a friend. Your role is not to be their therapist. Your role is just to be a welcoming smile, just like you would smile to your neighbor who you've known and who's been living in your area for your whole life. Try to welcome them into your community, and that's going to make them a valued part of your community, and then they're going to feel valued, and then they're going to be able to contribute more, and then leave the therapy to the professionals. But I wanted to connect something, because the reason you got into this field and this particular part of counseling was because, and I'm going to use this word, and let me know if this is okay, but almost like a soul connection to helping these poor human beings that were born into poverty, that were born into a war-torn situation, that were born into a situation where their parents left them with their grandparents.
Yeah, and I want to just, clarify a little bit. So a lot of people think that we get into psychology or counseling to deal with our own issues, but I do want to say that the more I have worked with these kids and these children, I realized my childhood was awesome. I realized that when I didn't get a toy, or I didn't get, the candy I wanted at the store or what have you, that I could survive that. For me it was traumatic, but believe me, when you work with these children and realize what has happened to them, you realize your life has been wonderful. And so I didn't have any issues, neither any experiences that happened personally to me where I can say I would ever experience trauma. It was, but when I was working with them, I remember a 12-year-old girl that was talking about her abuse. She suffered sexual abuse. And I remember her because it marked me when I was seeing how trauma was so painful, but people were there reacting physically. Like, she had no affect, no emotional.
No emotional. She was a flat affect, we call that.
Flag, yeah, nothing.
Where they look like they're not having any sadness or happiness.
Exactly.
Right.
And so she was telling me, I was, getting pieces of the story, and she was talking about her sexual abuse that she experienced. And she had one tear, just one tear came down, and no affect, one tear. To me, that was just telling me how much pain she had inside, but she had learned to not show it, of course. And so it was like, wow, I need to be able to help this kid. This is not your not normal, but this is not your regular type of, I feel sad, I don't know what, I'm anxious.
It wasn't your average kid you were talking to that had a problem.
Exactly. It was just somebody who was really in pain, but she couldn't show it. And so I had to, I did the intake. I transferred her to my colleague at that time. We would do intakes. There were two of us working in the program, and we would do the intakes, and we would transfer it to each other depending on how we felt. And I just felt she would open up more with a female than me. I'm not one of those that say that if you the child was abused by a male, you should not work with that girl.
Sure.
I'm not one of those. I don't believe in that. But at that time, I felt like this was what she needed, because my friend did Sentry. I didn't do Sentry. I was never trained on it, so I didn't do it. I did other things. So I felt like Sentry would help her put those things and what has happened to her.
And just for the uninitiated, Sentry therapy Oh no, you're fine. This is what we do. We just have a normal conversation and then we explain it.
Yeah.
So sand tray therapy, I'm not even trained in that, but I know a little bit about it. Is a way of processing traumatic events and really almost pretty much also childhood emotions, different experiences in a way that uses symbolism and metaphor that can bring out important points that maybe a child can't verbalize, because most children want to play.
Yeah.
And so sand tray resembles playing, and yet it's so deep. I mean, I've seen adults do sand tray, and they're like, oh my gosh, this is the most in deep I've ever gone in therapy, because I use these figures and these toys as metaphors to what was going on in my life, and I finally understood it. So is that what's your...
Yeah, exactly. And I want to say something. I went to a trauma training, because I go to trauma trainings, and every other year I go to Boston, where the gurus of trauma get together. Van der Kolk, Bruce Perry, and all of those people. You know, Daniel Siegel.
I love Daniel.
Peter Levine. I watched Peter Levine last year. I was there when he was there. So I go every other year. But I went to this training, and my friend, who was a trainer, said that all humans, including adults, like to play, because Anna Freud said that the language of children is play, right? So, but my friend said that even adults like to play. She said, "Why do you think we got all these big cars? Why do you think we got all these houses?" It's like, we all like to play. Play is really the language of all human beings. I guess there's some studies with chimpanzees that are studying about play. That she's a researcher, so she likes all of that. I really admire people that like to study. I value academics. I'm not one of those. I do read and I do go to trainings, but I'm not so much into the research part, but I am more into connecting with the human beings, which I'm not saying the research is done, but I just like the clinical application. I like to, what can I use with my clients? How can I help my clients be better,
You said even at the beginning of the interview, you were called into helping people. And I feel the same way, that I was called into this. I didn't totally choose this. I eventually chose it and went to get my master's degree, but I just kept getting pushed into it by something. And so what we're saying there is, we stand on the shoulders of giants who research. And thank goodness for all the amazing research that's been coming out in the last 15 years on the brain, and the Norton series on interpersonal neurobiology, and the neurobiology of trauma, and all the experts. There's so many more we could keep listing. We won't keep name dropping.
There's a lot of them.
but they're taking science to a new level to show that counseling, that talking to people and doing our quote unquote techniques and what we do actually changes the brain. You can see it in MRI scans. You can see physical hard outcomes change because people's cortisol levels go down, their high blood pressure goes down. They are able to regulate their emotions. They're able to function. We're able to see this in hard outcomes now. And where, before people thought counseling might just be some sort of thing to help people complain and vent. It's not that. It could be that, I guess, if you wanted to. But the point is that we're learning this research, and then they're writing the books, and then these awesome experts we're talking about are actually bridging the gap and saying, okay, clinicians, you have a doctorate and I have a master's. Hey, but you
probably know more than I do.
Whatever. Okay, well, we won't debate that. We'll just keep going, because we'll argue too long. But so, hey, clinicians, look at all this amazing science, learn the brain, and then look how you can then turn this into what you do in your counseling hour. And it is amazing what we can learn now. And it's all backed by research, and it's evidence-based. I mean, that's a whole other thing. But
and this is what I want to say right now. There's also research to show, but I want to say that once your client connects with you and they trust you, and once they feel that they're in a safe environment, which is why we say that contained, you can let them be the painter of their life. You can start helping them paint their life and tell you their story in a very, in where they know that you are caring, that you care for them. Whether you're a therapist or not, if you show care towards a human being, that's what's going to help them feel better. I know I can go to you because you care. You really care. You pay. You listen. And we have to understand that when we work with people from diverse cultures, we can never be an expert in their culture, and we need to recognize that, and not to try to show them, yeah, I know about your culture, I know about, no, you read for yourself so you can know and kind of understand where they're coming from, but you really work and let them be who they are, let them show you, and maybe ask questions. Oh, I noticed you wear this, it doesn't mean anything, or to you. Right. I always say to you.
What does it mean to you?
To you, and then they'll say, oh yeah, my culture, because you can never separate from culture.
Right.
You know, I read somewhere, and I don't know where, but I read that culture is to men what water is to fish.
Yes.
You know,
yes.
Meaning you can never really separate that. So it is wrong for anyone to say you're in America now and you need to be. And I'm saying that is my opinion, by the way. Okay,
yes.
That, and I'm an immigrant too, but I have been in the U.S. for almost 30 years now, where I have acclimated and I probably act more, I guess, American in a certain aspect. Sure. And you know, but the point is that we have to let people be who they are. Their language is their identity. You can never ask someone from a different country, a different culture, to change their language completely and stop speaking it, because that's their identity.
Right.
In some countries, in some cultures, that religion is part of their culture. It's not like in the U.S. where you can change. Oh, tomorrow I want to be a Presbyterian. Oh, you know, I don't like them. I'm going to go with the Catholics. Oh, I don't like the Catholics.
Right.
I'm not with the Baptists. No. In some countries, you know, their religion is their culture too.
Right.
You know, they're not separate. And so we have to understand that they are who they are, and they were forced to be here in a sense to survive.
Right.
You know, we all want to survive as a human being. So we have to understand all of that and just be kind to them and learn from them. And if they want to learn more about this country, this culture, then you teach them that.
Well, I would say this. I think that's the whole authoritarian versus coming alongside somebody and loving on them and trusting them, because quite frankly, and I have a couple quotes here that were perfect. I wanted to read about this, but quite frankly, like when you come to another country, so I went abroad and lived in Ireland for a little while and to study, and I was in Spain for a couple months and different things. Like, I learned about those countries. I learned so much, and yet I was still, my American culture was everywhere, and people would joke and they say, wait, why do you do that? And I'm like, what do you mean, why do I do that? That's what everybody does. Oh, wait, no, that's what Americans do. So, you know, but I learned so much about Ireland. I learned so much about Spain. I went to other countries, too, but those were where I spent the most time. And, you know, of course, so when immigrants come here and refugees come here, they are going to learn about America. Everybody, relax. They are everywhere they go. The TV, the radio, they're going to learn. Most people will learn English depending on their age, but let them go at their own pace. So what you're saying is, don't beat them over the head and say, abandon your culture, abandon your religion. You're here now. No, let them practice, but understand that they are going to be assimilate at their own pace, and especially the children are probably going to assimilate, acclimate at their own choice. But it's their choice, not ours, to say that. And so obviously, if they're going to get a job or something here, they're probably going to have to know English.
They're going to have to, yeah.
And so that we have to trust that they're going to do that at their own pace, and that by loving them and inviting them into our community, that they're going to want to have both cultures. They're going to want to have our culture, and they're going to want to also retain their culture, because that's their identity. So we, if we're loving on them and being honest and open and empathetic towards their plight, they're going to naturally adjust better. And I know you got more to say, and then I'll read these quotes. Go ahead. I thought you seemed like you had more to say.
I wanted to talk because I don't know if you know about the Lost Boys, the boys from...
the Lost Boys? Yes, I met the Lost Boys. They went to my high school. Some of them did,
well, you know, Arizona, Phoenix in particular, was one of the states that cities that brought them.
Yes.
So
from Somalia,
exactly.
Right?
Sudan, I think, or... I don't remember, but
you know what, it might have been Sudan. We had several at my high school that told us their stories.
Yeah. So, but if once they became adults and they got jobs, you know, some of them, and there's actually stories out on YouTube you can watch, where they brought their mom or grandmother, you know, to the U.S. to see them, and when they were waiting for that, they were wearing their clothing from the cultural clothing, and they were just chanting and doing whatever they needed to do. Because they can, even though now they've been in the U.S. for so many years, they're still who they are. You know, still they are still the boys. You know, they came. I guess their life did not change fully in the sense of my identity now is American. You know, I'm still who I am. You know, And so, like, when I was talking about me, you know, I am very, in certain aspects, you know, I'm very U.S. Acculturated, you know, but there's certain things that I'm still, you know, part of me, like language and other things, you know, I would never stop speaking it because I'm in a different country. When I went to Spain, you know, I noticed too that they had different words in the language, and they didn't take my plate right away. Like, I hate that about the U.S. that you're eating, they like take your plate right away. And, you know, like I don't know, they're saying they don't want you to see that, or they want you to they're telling you to leave. But in Spain, they left it there. In France, they left it there. I'm like, yes, you know, nobody's bothering me with my plate.
Right. Well, yeah, eating's a big difference.
Yeah, it's different.
In different countries.
Yeah.
In the U.S., we eat pretty quickly. That's a reputation. We eat a lot, and we eat it really quickly. But and I was confused when I was there for a while because I was when I first arrived, I was impatient because I was thinking, what, did our waiter leave? Are we gonna be served? And then they would bring out the courses very slowly.
Yeah.
And then eventually I adapted and I liked it. And so you know, and one of my things I'm trying to be more mindful about is not eating too quickly. It's not good for your digestion. But anyway, so I learned, you know, part of the culture and I was in France too, in France and Spain, where especially like eating slow meals, eating courses, and sort of having a long discussion over food. And that's something that I've actually, you know, just last night I've sort of adapted that with some of my friends in the U.S. I've brought part of my travel experience to the U.S. because a lot of my friends, what we'll do, last night my friend cooked food for us, and we talked from 6 p.m. Until 10:30 p.m.
Oh, no.
That's why I'm a little tired this morning.
Oh,
and we had food, and we had a little bit of wine, and we had some dessert, and we ate slowly and mindfully, and we talked the entire time, and we didn't do anything else. And so that's something I feel like is attributed to part of my cultural experience, and that yet I'm still American. I'm still eating American food, whatever.
Yeah,
you know. But, so part of it is we're all human, and so coming back to that, we're all human, and I think that sometimes we forget that.
Yeah. We
put these labels on ourselves, because of course, you know, we do obviously have a U.S. passport. You know, we have these labels. I have allegiance to this country, but yet we're all human, and so we have to remember that when we're talking about refugees and immigrants, these are just humans. If they were born here, you know, they might have had different names and different parents, but they would be the same soul is in that person.
Exactly.
And so they've just gone through these hard times. It's hard for us to understand it because in the U.S., mostly we have not been displaced. For the last couple hundred years, we have not been displaced. We have not... very few attacks on U.S. soil have happened to us, and so we're lucky in that way. And I know
and blessed too. I mean, we have to admit that the U.S. has been blessed, and it's a blessing to live here.
Yes.
But you had not, like you said, experienced suffering.
Right.
You know?
Not to that degree at all.
Not to that degree at all. I mean, to that level, the world has suffered. You know, so so people should treasure that and appreciate that. You know. And because hopefully we'll never have to experience any of that. I'm not really looking forward to experience any of that.
No, me neither.
You know, but you know, but yeah, you're right. It's we just, I think the empathy with this I finish. But empathy, understanding, like you said, you are a human being. You and I are different. You have blue eyes, I have brown eyes. Okay, mine are prettier than yours, but okay,
I'll let you in that one.
We won't fight.
Right.
But you know what I mean? It's like. But we are still humans. We still suffer. We still laugh. We still eat. You know, one day we're all gonna die. Both of us, right? And so, but we're still connected somehow because our humanity is really what connects us. Yeah, there's similarities and there's differences, and we have to acknowledge that. But we're still humans, and I think that the bottom part is that regardless, if you think, oh, they're so different, well, they're not so different. You are not so different.
Get to know them.
Exactly. We are really the same in one, you know. So.
Oh my gosh, I don't know if I can actually stop that. So this is the official end of the podcast because that was just beautiful. I can't even. That's exactly my sentiments. I share that completely. I had a couple quotes about immigration I wanted to kind of read because I felt that they were so true. So this was, and then and then I want to make sure everyone knows if they're in the Phoenix area, they can see you for private practice counseling if you've got any space.
Yeah.
So how do people contact you?
They could call 602-903-9005.
Okay.
602-903-9005. See, now I'm like you.
And leave a message for Dr. Vargas. Do you have a website yet, or?
I don't have a website yet, actually.
Okay.
I'm still a small private practice. This is
that's right. This is your side.
Small private practice, yeah.
You've got your full-time job too.
I have my full-time job.
So, So you might have to be on a wait list, but you can also refer people. If,
I
want.
have enough friends. I don't take anyone that I cannot help. So I always talk about what are you looking for, and because again, as you know, our ethics, we cannot do that.
That's correct. So you can call Dr. Vargas if you're in the Phoenix area and you want to do some counseling. This is a quote I wanted to kind of leave us with. The bosom of America is open to receive not only the opulent and respected stranger, but the oppressed and persecuted of all nations and religions, whom we shall welcome to a participation of all our rights and privileges.
Oh.
Do you know who said that?
No.
George Washington.
Wow.
The first president.
Well, he was a president for a reason.
And then I have two more that I just want to read because I thought they were great. Nearly all Americans have ancestors who brave the oceans, liberty-loving risk-takers in search of an ideal, the largest voluntary migrations in recorded history. Immigration is not just a link to Americans' past, but it is also a link to America's future. Who said that?
I have no idea.
George W. Bush.
Oh, good for him.
Yes. And one more. There's two more, sorry. Everywhere, immigrants have enriched and strengthened the fabric of American life. That's John F. Kennedy.
Okay.
And I'm just going to go two more because I'm just on a roll. I've always argued that this country has benefited immensely from the fact that we have drawn people from all over the world. That's Alan Greenspan.
Mm-hmm.
And then remember always that all of us, you and I especially, are descended from immigrants and revolutionists, Franklin D. Roosevelt. And so I just wanted to leave that with everybody because there's a lot of political debates which we are not even going to get into. And most of us counselors, we do not get into that because we want to help people.
Mm-hmm.
And regardless of where you came from, what your political opinions are, where you're from, what happened to you, whether you grew up in opulence and wealth or whether you grew up in very difficult trauma, we are here to help you because we believe that makes the world a better place, person by person, everybody you affect, rich or poor, prestigious or having no status in our culture or from a different culture. We want to help spread the message that we're all people, and then also people can help each other in different ways. You don't have to be a counselor to help people.
It's better to build bridges. It's better to help each other than to hate each other. And as a therapist, a code of ethics prohibits us from discriminating due an immigration status. It's noted there. I teach ethics, so I know.
Yes, that's correct.
I really don't understand why you would want to be a therapist when you're going to be discriminating because people are different than you are. I just don't understand that. Don't get that. So yes. I respect that's your choice to be like that. But to me, therapy, counseling is to heal, to help heal people, to restore themselves and to find fulfilling lives, and be happy as the Constitution of the U.S. says, right? Seek happiness, right? So that's what I had to say is that I respect them too, of course, as their belief system, if they want to hate or reject people based on the differences, but believe me, at the end, we all end up dying. So
yes, so we need to think about that. That's some existentialism, which might be another podcast topic. That will be a future podcast topic, existentialism. So, Dr. Vargas, I appreciate you coming here, or letting me come into your office and interview you, and I'm excited to post this later. So,
okay, thank you so much. Appreciate it.
And there you have it. I hope you enjoyed my interview with Dr. Noe Vargas. This has been Paul Krauss, licensed professional counselor, and you've been listening to The Intentional Clinician. Dr. Vargas actually does see people in Phoenix, Arizona, so if you're there, you can look up Dr. Noe Vargas and go to his private practice. And also, he is a teacher at Grand Canyon University and the assistant dean. I'm not sure how many courses he's teaching right now, but he's a fantastic teacher and very knowledgeable. I am located in Grand Rapids primarily, Grand Rapids, Michigan. If you would like to work with me If you know someone who's been through trauma, or if you've been through trauma yourself, that is one of my specialties. You can give me a call directly at 616-365-5530. That's 616-365-5530. Or go to my website, paulkrauscounseling.com or healthforlifegr.com. There are several other clinicians and 2 naturopathic doctors working at my office, both males and females, and almost all of them have great experience working with trauma. So we'd love to help you out if you're in the Grand Rapids, Michigan area, or if you even want to work remotely and you're in the Michigan area. Our main number is 616-200-4433. That's 616-200-4433, or find us on the internet by Googling Health for Life Grand Rapids. Thanks so much for supporting my podcast and listening. I am still taking suggestions for future podcasts. I've got some great interviews coming up and a few solo podcasts. I appreciate everyone who's written in to my email and talked to me about the podcast so far, and I'd love to hear from you if you're listening. Tell me what you like, tell me what you don't like. I'm still new to this podcasting thing, and I would love to hear your feedback. Thank you so much for listening, and take care of you.
Okay, so I'm going to ask you a test question to see how our volume is. Okay, so, favorite vacation spot?
Hawaii. I like Hawaii. I went to Hawaii like a couple years ago. I know, like 4 years now. It's really beautiful over there. Not to say more.
Where'd you stay?
We stayed in Lahaina. I think it's called Lahaina. I'm not sure if I'm pronouncing that correctly, but it was just really, really nice. It was just, the weather was beautiful. Actually, the weather resembles where I came from in Mexico.
Okay.
So that was really good because memories kind of came back just because of the weather.
Oh, very good. Very good. Okay.